Good afternoon, everyone. Thank you for joining us today for Golder's webinar on healthy buildings amid COVID-19. My name is Elaine Bunnell, and I'll be moderating today's session. I've worked in the marketing team at Golder for 10 years, based in our Mississauga, Ontario office in Canada, and have had the opportunity to work with our presenters throughout those years. At Golder, health and safety is our top priority. We always begin our business meetings with a health and safety share. So today I thought I would share an interesting notice that was posted on the Centers for Disease Control and Prevention website. The site mentions that calls to U.S. poison centers about cleaner and disinfectant exposures increased by 20% from the period of January to March of this year compared to the same time last year. In efforts to prevent the spread of COVID-19, everyone is on high alert to ensure our homes and offices are clean and disinfected. However, we all need to be mindful that we are cleaning safely. As mentioned on the site, please remember to follow label directions, don't mix chemicals, wear protective gear, use cleaning products in a well-ventilated area, and store chemicals out of reach of kids. Now, before we begin, here are a couple housekeeping items to note. Your microphones have been muted, but you can use the questions panel to submit questions or comments throughout the webinar. We will address inquiries at the end of today's session. And just remember that the webinar will be recorded and made available upon request. Now, let's introduce our speakers for today's session. First up, we have Andreas Wagner, who is a principal and industrial hygiene practice leader, based in Florida, who is responsible for the oversight of occupational health, safety, and industrial hygiene services across US, North America, and globally. He brings over 30 years of consulting experience and expert testimony, hazardous materials control, microbial assessments and remediation, indoor air quality, Legionella, infection control risk assessments, and conducts regular training programs. Today, Andreas will cover the concepts of healthy buildings and the routes of transmission, as well as water quality. Next, we have Jason McGonigal, who is a principal and senior EHS practice leader in our Whitby, Ontario office in Canada. He brings over 23 years of EHS training and consulting experience with a focus on managing and directing health and safety, hazardous material, and industrial hygiene activities. Jason will be discussing cleaning and disinfection during today's webinar. And lastly, we have Dave Aris, who is an associate and certified industrial hygienist and Canadian registered safety professional in Golder's Calgary, Alberta office. Dave has over 22 years of experience in chemical, physical, and biological hazard assessments, including exposures, assessments, and managing hazardous material remediation projects. Today, Dave will be focusing on indoor air quality during the session. And now I am going to get the show started and pass the mic over to Andreas Wagner. Andreas?
Yes, hi. Thank you very much, Elaine, for the kind introductions and the timely health and safety share. I will get us started by providing an overview of the topics covered and then dive directly into the first two sessions of the webinar. So the objective of this webinar is to provide an overview of current thinking and best practices to what businesses can do now to prepare buildings during and after a pandemic such as COVID-19. A review of current understanding on how buildings can play a crucial role in disease transmission will be presented, followed by discussing best practices regarding cleaning and disinfection, operating ventilation systems, and maintaining safe water quality. The intent of this presentation is not to provide details on what COVID-19 is and how widespread the pandemic is, but more to provide practical solutions and recommendations to building owners and managers on how to prepare and maintain buildings to reduce the transmission of COVID-19 as we are reoccupying our buildings. Much of what will be discussed applies to really any sector in a work environment, with maybe the exception of healthcare, where for obvious reasons exposure to the virus is much more significant and additional controls do apply. So how does healthy buildings concept relate to COVID-19? Healthy buildings is a concept that refers to the physical, physiological, and social health and well-being of people in buildings and the built environment in general. Buildings can be a key promoter of health and well-being, since most of us spend the majority, typically more than 90% of our time indoors. So buildings can play an important role in minimizing the risk presented by different modes of disease transmission. Due to the COVID-19 crisis, there has been a heightened awareness of how buildings influence our health and can play a critical role in the spread of pathogens through air, water, and surfaces. This is going to come with a demand for better performing buildings related to our health. As COVID-19 pandemic winds down and communities emerge from quarantine and work from home, it is very likely that a residual fear about our workplace health and safety will linger. In the post-COVID-19 workplace, we will all be much more acute aware of the hazards associated with surfaces we touch and the people we interact with after this prolonged period of social distancing. This awareness will take a toll on our physical health as well as on our mental health, both in the near term, but also in the long term. Now, technology can help to reassure employees that their workplace is safe as possible, and making certain data available to people can alleviate some of this fear, and at the same time also build trust. Advances in technology and sensors provide opportunities to measure a number of control multiple facets of the space they occupy, including things like density, which is important to maintain social distance requirements, air quality, cleanliness, and even employee tracing. It will be impossible to completely alleviate the concerns of workers until a vaccine or treatment for COVID-19 has been found. But technology can help to reduce the fear of going back to the office, including benefits that will likely outlast the pandemic. Finally, changes in design and use of our workplaces during and after a pandemic are also impacting how we feel about our workplaces. Many of the new ways on how we do business and how we behave in our buildings will likely remain in place well after the pandemic. So regardless of the social distancing requirements in place right now, the quality of a building environment will have a profound impact on occupant performance. In addition, cleaning and disinfecting workplaces will also be mandatory in the COVID-19 and post-COVID-19 era. The way cleaning and disinfection is done and what chemicals are used may impact the building environment. Traditional one way to assess the quality of a built environment has been to conduct indoor air quality or IAQ assessments. This includes measuring thermal comfort parameters such as temperature and relative humidity, general IEQ parameters including carbon dioxide concentrations, typically done to evaluate ventilation, and specific contaminants such as dust, allergens, and molds. Now, adding water quality, lighting levels, noise, well-being, and even safety and security may provide a more complete and holistic picture of the indoor environment, and is often referred to as indoor environmental quality, or IAQ. Workers are often concerned that they have symptoms or health conditions from exposures to contaminants in the buildings where they work. This provides unique challenges regarding SARS-CoV-2, the virus causing COVID-19, as it is most not visible and infected workers are the primary source of the virus. So let's talk about human transmission of viruses, specifically related to how COVID-19 can be spread within a building. So as shown in this figure here, basically there are two dominant transmission routes. First, via large droplets or particles emitted when sneezing or coughing or even talking. And two, via surface, also referred to as fomite, contact, which is hand to hand, hand to surface, etc. Now, a third transmission route that is less talked about in North America, but is gaining more attention from the scientific community, is the fecal-oral route. This is why, as a precautionary measure, it is recommended to flush toilets with a closed lid and avoid dried out drains in floors and other sanitary devices by regularly adding water so that the water seal works properly. Now, as you probably heard, there's quite a bit of talk about airborne transmission and this virus. So let's spend a little bit more time on that. Via air, there are two main exposure mechanisms. First, close contact transmission through large droplets, typically greater than 10 micrometers in size, which are released and fall to the surface, not further than usually 1 to 2 meters or 3 to 6 feet from the infected person. Now, droplets are formed from coughing and especially sneezing, which forms many more particles. Now, most of these large droplets fall on nearby surfaces and objects, such as desks and tables. Now, people could catch the infection by touching those contaminated surfaces or objects, and then touching their eyes, nose, or mouth, basically mucous membranes. It is people, if people are standing within 1 to 2 meters or 3 to 6 feet of an infected person, they can catch it directly by breathing in droplets, sneezed or coughed out or exhaled by them. The second exposure mechanism for airborne transmission is through small particles. These are typically defined as less than 5 micrometers in size. Now, these may stay airborne for hours and can be transported long distances. Now, these are also generated by coughing and sneezing and talking. And these small particles are also referred to as droplet nuclei or residue, form from droplets which evaporate very quickly. This happens less than a second and dry out. The size of a coronavirus particle is 80 to 160 nanometers, which is less than 0.2 micrometer. And a micrometer is a millionth of a meter, so very small. And it remains active for up to 3 hours in indoor air and up to several days on room surfaces at common indoor conditions. And we'll talk more about that in a minute. Such small virus particles stay airborne and can travel long distances carried by airflows in the room or even by the ventilation system. Now, we know that from airborne transmission has caused infections during coronavirus pandemics in the past, such as SARS or MERS. For COVID-19, it is likely but not yet confirmed, especially for non-healthcare buildings. So therefore, all possible precautions against airborne transmission in indoor scenarios are recommended and should be taken, and Dave will cover these in much more detail during his session. All right, so that's the other primary route of exposure, as I mentioned, is fomite. Now, fomite exposure requires an inanimate object to carry a pathogen from one susceptible host to another. This exposure often involves a secondary route of exposure, such as oral or direct contact, for the pathogen to enter the host. For example, fomites include contaminated vehicles, shovels, clothing, desks, phones, etc. Basically anything that we touch. Now this slide here summarizes how long the SARS-CoV-2 virus can survive on different types of surfaces, ranging from a few hours, such as on paper and tissue, to several days on plastics and glass. Note the longest time period referenced in this particular slide was 7 days on personal protective equipment such as masks. This has implication on the reuse and disinfection of PPE. In general, the lifespan of the virus on a given surface depends on a myriad of factors, including the surrounding temperature, humidity, and type of surface. In general, though, the virus will not survive for more than 5 days on most of surfaces that we find in buildings. There are exceptions, but as a general rule, most of the surface that we have in our buildings, 5 days appears to be the longest time period. In a recent study done in Hong Kong that looked at temperature, type of surface, and use of disinfectants, it was determined that at room temperature, there is a 3-log reduction of detectable virus by PCR, which is a technique we'll talk about later, after 7 days, and no detection at all after 14 days. So this is really in line with the current CDC recommendations that if more than 7 days have passed since a sick person visited or used the facility, additional cleaning and disinfection may not be necessary. I will now turn it over to Jason McGonigal, who will talk about cleaning and disinfection. Thank you.
Hello, everyone. Thank you, Elaine and Andreas. In the next few slides, we will be focusing on your facility in the context of healthy buildings. It's designed to provide insight pertaining to maintaining a healthy and safe work environment for sites potentially contaminated with a pathogen such as COVID-19. It's been prepared based on our review of guidance materials, scientific evidence, current legislation, and similar infectious disease guidelines. However, it is important to note that because of the dynamic nature and fluidity of the information available, limitations do exist, as you can all appreciate. Before we start, it's important to understand a few definitions that seem to be used interchangeably today. However, please note there is a difference between these two. So the two terms in the context of COVID-19 are cleaning and disinfection. Cleaning of a site entails using a detergent such as soap and water and other cleaning agents to physically remove visible dirt and grime, whereas disinfecting entails the use of chemicals to eliminate non-visible microorganisms. It's important to know that there are specific procedures that must be followed when using a disinfectant. One of the most important is allowing necessary contact time on the surface to kill the organism. One of the first steps associated with workplace cleaning and disinfection is undertaking a proper risk assessment and developing a plan as necessary. The purpose of the risk assessment is to evaluate the site to determine the extent and severity of the contamination, if any. This will form the basis of your plan to develop a cleaning scope of work and determine the levels of precautions necessary. A risk assessment will also assist employers with completing their occupational health and safety responsibilities and demonstrating due diligence, i.e. what was reasonably practicable under the circumstances. You may ask, what is reasonable? As you can see, society is currently dictating this through industry standards, practices, and guidelines, and the legal community will certainly refine it. We are finding that external companies and internal cleaning agencies may be using untrained staff or uncertified chemicals, which are resulting in overexposures, or the improper use of disinfectants and personal protective equipment, particularly respirator and cartridge selection. So in a rush to clean a site, there is a lack of oversight, checking, and documenting the work activities. So in our view, just don't undertake a cleaning without a risk assessment. So when developing your plan, consideration should be given to some of the following. So your team members, assembling a team, owners, managers, facility and property managers, vendors, contractors, insurance brokers, and possibly tenants. Define those responsibilities. Determine risk profile. Do I have sensitive individuals, workers, daycare, healthcare, food preparation? Are my custodial staff properly trained? Do we have proper insurance? Consult with legal counsel if necessary and your insurance brokers. Use and type of facility, office, manufacturing, construction, healthcare, food preparation. Look at occupancy. Have you evaluated what you need for reoccupancy? Remember, some sites did not fully shut down for essential services purposes. Was the site fully or partially occupied? What was the length of the time the site had remained unoccupied? Look at the types of surfaces within the work area. Are they porous, non-porous? And also, do you have the internal resources and competency to complete a risk assessment and then to develop a plan? Will you need external assistance? A few other things. Are there known COVID-19 cases in the workplace? And how do you actually know this? Are there any known or potentially contaminated areas? Determine, do you need a cleaning or disinfection, or potentially both prior to reoccupancy? A few other considerations. What building systems have been affected? Your HVAC system, is it neighboring or adjoining facilities and shared? Water systems. Look at who will be undertaking the cleaning and disinfection. Will it be internal or external? How competent and experienced are my staff in performing these tasks? Will you need to provide awareness and hazard awareness training? Personal protective equipment, respiratory protective equipment, disinfectant application. What exactly should I communicate with staff, contractors, tenants? And then finally, look at documenting. These are all factors that come into play when determining your plan and should be given consideration. Once you have completed your risk assessment and determined that a cleaning and disinfection plan is necessary prior to reoccupancy, what's next? Well, following known professional standards is certainly the best starting point. Organizations such as the EPA, the IICRC, Restoration Industry Association, Environmental Abatement Council of Ontario, Centre for Disease Control, ASHRAE, Health Canada, BOMA, etc. These are all a few examples of reputable sources. Please remember that some states and provinces may have industry-specific cleaning standards and requirements. For your consideration, a practical guide threshold for determining cleaning versus disinfection is as follows. This is based on the emerging and existing pathogen cleaning best practices for environmental professional services. It provides 3 levels, 1, 2, and 3, to help you understand what level of cleaning and disinfection is required. As you can appreciate, this is only one approach and you may find others. For example, if there are no confirmed or assumed cases of the pathogen, then a level 1 precautionary cleaning is recommended. If potential or confirmed cases of the pathogen are present, then a more thorough level 2 or 3 cleaning may be appropriate. Please note, a proper risk assessment should be undertaken by a competent person or supervisor who has been provided with all necessary information to maintain an informed decision. As you can appreciate, these protocols will be much more stringent in hospitals or healthcare settings and other sensitive sites. Just want to quickly focus on a few things. Generally, most guidance documents focus on high-touch surfaces, doors, handles, desktop chairs. The Environmental Protection Agency and Health Canada have listed disinfectants currently thought to be effective against COVID-19. They do urge users to follow the directions on the product label, since some disinfectants require more time to kill the virus than others. If the direction for use for viruses list different contact times or dilution, use the longest contact time or most concentrated solution. A few examples. You can look at accelerated peroxides. These are strong oxidants and fast acting. However, they can be corrosive to aluminum, copper, zinc, and brass. So please be aware of the surfaces these products are being applied to. Diluted household bleach. Again, another caution, overexposure is very possible. For folks that have been in the industry for a while, you may be able to remember that when the mold contaminated building materials first came to prominence, many organizations recommended bleach. However, this product is not usually recommended today because of the exposure potential. Other products such as ammonia, it's a detergent with non-corrosive properties, but has a long dwell time. Example is Virex 256. Also products with 70% alcohol. a few things to remember. Some cleaning products may not be appropriate to hard and soft surfaces. Electronics, specialized equipment may require specific cleaning protocols to avoid system failure. Performing cleaning and the need of personal protective equipment. Some cleaning products may produce adverse health effects depending on the concentration and use, so be aware. Remember, in the US, if a product doesn't have an EPA registration number, or in Canada, a drug identification number, then there is no data in their respective databases showing that, that these chemicals will work and can be used safely. Here are a few high-level points to consider when undertaking cleaning and disinfection activities. Consider about return air vents should be covered when undertaking cleaning activities. Opening doors or windows to reduce the level of airborne droplets is recommended by the Center for Disease Control. HEPA-filtered negative air machines can reduce the airborne particulates disturbed during cleaning activities. Seal occupied areas from non-occupied areas. Remember, EPA has strict rules regarding products which can be used in HVAC systems. The cleaning and disinfection of an HVAC system may need to be evaluated separately. The American Society of Heating, Refrigeration, and Air Conditioning Engineers, ASHRAE, has produced a position paper on infectious aerosols that can also be referenced. Additional considerations, proper documentation. As a minimum, this should include a written description of work, site photographs, cleaning and disinfectant use, training certificates. In short, document that the work was completed correctly. The objective here is to demonstrate that you have taken reasonable steps to protect employees, personal protective use and care. Personnel who will perform cleaning or surface treatment, including filtering face pieces such as an N95 mask, must comply with regulations established by authorities, OSHA, Health Canada. Understand your legal responsibilities as requiring a worker to wear a mask, which is different than recommending it or making it optional. Also remember, masks are not respirators and different requirements apply based on applicable OHS regulations. For example, a N95 is considered a respirator and does require fit testing, medical evaluation and surveillance, training, and a formal respiratory protective program, whereas the use of masks do not have such requirements. Determine if validation inspection testing is necessary. Discuss with a consultant or professional to determine if validation inspection surface testing is necessary. And then a detailed post-work visual inspection is an important step to evaluate the effectiveness of the efforts undertaken. As you can appreciate, a thorough cleaning is important to avoid further spread of COVID-19. There are several tests available which provide an opportunity to assess the need for cleaning and document whether cleaning is being performed adequately. For example, PCR, polymer chain reaction testing, and surrogate testing can be used following a treatment to indicate a surface cleanliness. These tests are usually completed via a swab after a disinfectant cleaning agent has dried completely and evaporated. Generally, PCR test detects the genetic information of the coronavirus, the RNA, and can document the presence of the virus on solid surfaces. Surrogate testing, however, such as ATP or micrometer, are two examples. This type of sampling does not test specifically for COVID-19. However, this could assist with demonstrating that the sampled surface area has been effectively cleaned and free of bacteria or fungi, which could act as a surrogate. Both have advantages and disadvantages of use, including cost, turnaround time, value, statistical relevance, false positives. In short, if you foresee a need to undertake environmental testing, then a sampling strategy should be developed to meet your stated objectives. In any event, the sampling chosen should be undertaken by a competent person. Finally, I also want to briefly speak about a few lessons learned that should be considered as part of your overall plan. First of all, check your insurance. If you do retain a third-party contractor to undertake your cleaning and disinfection activities, consider this. Do the contractors have appropriate general liability, contractors' pollution liability, professional liability, and workers' compensation policies? Ask if they have any exclusions for virus or microbial matter and the application of disinfectants. This may result in a change to insured risk. Leases and contracts. Review new procedures, lease contracts, operational changes, and legal exposures. Remember to document. The old saying, if it's not written down, then it didn't happen. Document all work undertaken. The objective, again, here is to demonstrate due diligence. Remember about training. Custodial staff are being asked to use new products. This can result in mixing chemicals, accidental poisoning, and confirm the training. As an example, Health Canada recently reported a 60% increase in poisoning since February 2020. So check product labels, safety data sheets to know the potential hazards and safe work practices for all cleaning and disinfecting products used. Look at emergency planning. Have a plan in place in the event there is a resurgence of the virus. Look at updating your policies and procedures to reflect the new norm. And finally, communicate. Discuss with your staff what you have done, what they will need to do, follow up, and then comment. Communicate with tenants, vendors, and contractors. Share your plan. Ask them to share their plan. Stay informed. So thank you very much. And I'll now turn it over to Dave Aris.
Thanks, Jason. Optimal indoor air quality refers to the air quality within and around buildings and structures, especially as it relates to the health and comfort of building occupants. Understanding and controlling common pollutants indoors can help reduce your risk of indoor health concerns. Poor indoor air quality has been linked to sick building syndrome, reduced productivity, and impaired learning in schools, colleges, and universities. This is obviously a complex issue for building owners and operators. ASHRAE's definition of acceptable indoor air quality is air in which there are no known contaminants at harmful concentrations as determined by cognizant authorities, and with which a substantial majority, which is typically 80% or more, of the people exposed do not express dissatisfaction. This means that at any given time, there are 20% of occupants of a building that would be expected to not be satisfied with the overall air quality. According to ASHRAE, this is considered to be an acceptable scenario. Next slide, please. With restrictions beginning to lift, employers and building owners are challenged with difficult questions pertaining to preparing the office to reduce the risk of COVID-19 transmission during operations and addressing IEQ concerns prior to reoccupancy. As we all know, building indoor air quality is always an important factor for tenant comfort, and likely there will be a heightened perception or awareness during reoccupancy of workplaces and buildings following the lifting of stay-at-home orders and other restrictions that have been issued by public health authorities. Typically, IEQ assessments completed in buildings fall into three separate categories. The first category is complaint-driven, which usually involves addressing air quality complaints from a single or group of individuals in an office space, or it can be more widespread throughout the building. Usually these types of complaints tend to be non-specific. The second type of IEQ assessment that is commonly undertaken is related to tenant lease requirements. In our experience, these types of assessments are becoming more common as tenants have become aware of the importance on the indoor environment on worker productivity. The third type of assessment can be part of an employer's or building owner's annual proactive indoor air quality program. Again, these types of assessments have become more common in the last 5 to 10 years. As employers and building owners, we now know that good indoor air quality is good for business. With the upcoming reopening or reoccupancy of buildings in the post-COVID world, there will likely be heightened awareness and concerns expressed by employees and tenants about what steps have been taken to prepare workplaces for reoccupancy. Next slide, please. Similar to what has been previously discussed by Jason, it is important for employers and building owners to have a plan to address employee and tenant concerns regarding a building's air quality and drinking water quality upon reoccupancy, whatever date that may be. This may be more important at workplaces or buildings that have had reduced or minimal building operations personnel working in a building. You should update your plan regularly as situations change and as new information becomes available. It's important to share your reoccupancy plan with employees, tenants, vendors, and contractors, and also ask them to share their plans if applicable. The plan should also describe the actions to be taken if someone becomes ill with symptoms consistent with COVID-19 while at work. Next slide, please. The continual operation of the building's HVAC and mechanical systems is key to ensure ongoing employee and tenant health and comfort. This is key at the best of times, but will be even more important during reoccupancy. It is important to note that infectious aerosols, such as the coronavirus, can likely be disseminated through buildings by the HVAC system. However, this probably isn't a concern outside of healthcare facilities. Viruses that enter the ventilation ductwork will normally be carried out by airflow, so according to numerous experts on this topic, duct cleaning is not necessary in most buildings prior to reoccupancy. Since the start of the COVID pandemic, there have been a number of organizations that have provided good guidance on maintaining HVAC and mechanical systems, including ASHRAE, the RIVA, which is the Federation of European Heating, Ventilation, and Air Conditioning Associations, and BOMA, to name a few. We recommend visiting their websites for more specific information on HVAC and mechanical. Some recommendations provided by ASHRAE, RIVA, and BOMA include: continue to run the HVAC system in the building on a reduced, if not regular schedule, including evenings and weekends. It has been shown that extended ventilation will remove virus particles from the air and also release virus particles from surfaces in the building. Increase the percentage of outdoor air brought into the building. The general advice is to supply as much outside air as reasonably possible. This has to be taken into context of the outdoor temperature and humidity levels to determine if this is a viable option. Obviously, this may not be the best option in very hot and humid climates. Continue with regular HVAC maintenance, including regular filter changes or system upgrades. It's important to note that outdoor air is not a source of viruses. Therefore, there is no need to replace filters. However, you may want to consider upgrading to higher efficiency filters such as MERV 13 filters. Increasing exhaust and infusion of outside air for several weeks following reoccupancy of the building is recommended. To alleviate employee and tenant concerns and potential anxieties regarding the return to workplaces, employers and building owners and operators may need to consider some limited reoccupancy IEQ testing and possibly drinking water sampling by a third-party consultant. This type of sampling is likely very perception-based, but may be important to address tenant concerns. If sampling is conducted prior to reoccupancy, the testing may have a more contaminant-based focus, whereas testing after reoccupancy may focus more on typical IEQ comfort parameters that tend to be related to higher occupancy loads. Testing may be limited to a portion of the workplace or building, such as 30% of the floors, offices, and public spaces, or there may be a need for more widespread testing. This would depend on the type of office or building where the testing is being performed, as well as the type of tenants in a given building or office space. General indoor air quality parameters to be assessed should likely include comfort parameters, including carbon monoxide, carbon dioxide, temperature, relative humidity, as well as airborne contaminant monitoring for respirable suspended particulates and total volatile organic compounds, or TVOCs. A visual assessment of the building's air handling units to assess for potential contributors to poor indoor air quality should also be performed. This should include interviews with building operations personnel to document the steps that have been taken at the building prior to reoccupancy, and to make sure that these steps are well documented in the report that would be prepared by the consultant following the testing. The final report of any testing performed should be made available to employees or tenants upon request. Next slide, please. Some other possible testing considerations may include surface testing of high-touch surface areas, such as hand railings, elevator buttons, door handles, etc., to determine if they have been effectively cleaned prior to reoccupancy. There are surrogate surface tests, such as ATP meters, that were mentioned in the previous section. These meters do not identify viral contaminants, but can identify surfaces with high bioloads that may indicate that additional cleaning may be warranted. There are also several labs that have now come out with specific PCR analysis for the coronavirus. ATP testing has an advantage of being inexpensive and quick, but only measures bioloads on surfaces, whereas the PCR analysis is specific to the coronavirus, but is more expensive and takes several days for analysis. To address concerns of potential stagnant water due to lack of use, the collection of potable water samples should be considered from a selection of faucets and drinking fountains. Limited potable water sampling and analysis may include general water quality parameters, E. coli and total coliforms, and total dissolved metals, including lead and copper. With that, I'll turn it back to Andreas.
All right, great. Thank you very much, Dave. So as Dave mentioned, the other major concern as far as potential hazards are concerned that are associated with buildings is related to the water quality. Closures of many buildings have created an unprecedented decline in water use. And this in turn may have resulted in dissipation of disinfectants, such as chlorine, stagnation in water pipes and other mechanical equipment, such as hot water tanks, irregular temperature changes, especially in warmer climates where potable water systems may be sitting at room temperatures, which can promote microbial growth, lack of proper maintenance of cooling towers, and also any other water features if present, and also spas, whirlpools, etc., while not in use or being properly maintained, may have to be taken out of service and completely drained. We need to think about all of these as these conditions can lead to the potential for amplification of waterborne pathogens such as Legionella and other contaminants such as lead. Water service disruption is a major risk factor for Legionella and other waterborne pathogen amplification. So why Legionella? Why do we have to concern about that now, especially since we're worried about COVID-19? Well, first, Legionnaires Disease, which is a form of pneumonia and therefore also a respiratory disease similar to COVID-19, has similar symptoms to COVID-19, such as cough, fever, shortness of breath, fatigue, and others. In 2018, according to the CDC, there were more than 10,000 cases of Legionnaires disease in the US, and there have been an increase of 650% of Legionnaires disease cases in the US over the last 15 years. Just like COVID-19, most people are not impacted by Legionella, and people with underlying medical conditions and the elderly are at greatest risk. But Legionnaires disease has a higher fatality rate than COVID-19, so we have to worry about it as well. There's also concern about COVID-19 patients having secondary infections related to exposures to other pathogens such as Legionella during their actual COVID-19 treatment. So based on all of this, and depending on the condition of your building during the pandemic, proactive cleaning and disinfection of cooling towers and flushing of potable water systems and other water features may be required. Note, this also applies to alternative use facilities such as COVID-19 during the COVID-19 response. So those buildings are often unoccupied, which are being repurposed for the use during the COVID-19 public health response. This especially impacts healthcare, hospitality, education, commercial businesses, and convention and sport venues. Reopening these facilities without first conducting a proper water management risk assessment can lead to the exposures to waterborne pathogens and hazards such as Legionella and other water quality in these buildings. May not be safe for human consumption, such as having elevated lead levels that Dave mentioned in his presentation. So some general recommendations made by similar organizations that you've already heard us mention, such as BOMA, ASHRAE, and others, in response to COVID-19 and building operations regarding now water quality specifically, include during low and no occupancy and prior to building reentry, operate water systems, toilets, faucets, etc. on a regular basis to avoid the accumulation of biofilm and other bacteria, which can accumulate in as little as 3 to 5 days. In fact, ASHRAE recommends to do this type of operation at least weekly. Check P-traps, U-traps on all plumbing drains, that they are wet to confirm water seals have not dried out due to the lack of water flow. This can also lead to odors if not properly maintained. Continue to monitor and service all water systems, including hot water heaters, ice machines, filtration systems, etc. Now, regarding hot water distribution system, ASHRAE recommends to keep these systems circulating and store hot water at above 140 degrees Fahrenheit to avoid microbial growth within these systems. If the hot water recirculation systems goes down for an extended duration, a high temperature flush may be required before going back online. Now, if you have cooling towers, ASHRAE recommends to keep these systems running so the equipment stays in its best shape. If the chilled water system has to be taken down for an extended period of time, completely drain the cooling towers, chillers, heat exchangers, and associated piping. Leaving the system with stagnant water can result in severe corrosion, biofouling, and contribute to the transmission of Legionnaires disease. Lastly, if operating at a reduced capacity for extended duration, increase the frequency of testing and adjusting of biological control regimen by your water treatment provider. So you can see that there are lots to think about as it relates to your water systems in your buildings. So as you also heard from, I think, both Jason and Dave, recommending in their sessions earlier, regardless of the type of building or its use, it is recommended that you do a proper risk assessment prior to reoccupancy or during ongoing reduced occupancy conditions. Now, for water systems in your buildings, this should include the following items: a thorough review actually, of all building water systems, identifying potential risk areas or equipment, developing a site-specific water sampling plan. In some situations, the local health department may need to be involved as well, especially if the site had a history of Legionnaires disease. Measurements of water quality indicators such as temperature, pH, residual chlorine levels, and in some cases also conducting Legionella sampling. Recommending appropriate mitigation procedures as necessary, and updating the water management plan as per current applicable guidelines, such as those published in the US by CDC and ASHRAE. Now, hopefully, the building already had a water management plan developed prior to COVID-19. But if that is not the case, additional time and expertise may be required. As far as mitigation is concerned, this could include flushing or enhanced flushing procedures, hyperchlorination, and disinfection, especially for cooling towers, installing point-of-use filters in high-risk areas, or adding a secondary disinfection system. The latter would require significant more effort, including a much more detailed assessment than what we are talking about here, but may be necessary in some situations. Now, regarding testing for Legionella, some facility may require Legionella sampling, especially in healthcare and other buildings with highly susceptible occupants. Building managers or engineers may not be thinking about this right now, since we are all focused on COVID-19. So this brings us to the last slide of the formal presentation. And here I will just talk about some general or other considerations. Now, I'm an industrial hygienist, and my work and the advice I give to clients is based on science. This should be no different as it relates to COVID-19 risk assessments in buildings. Informed decisions based on science should translate in less business interruption, less employee confusion, with everyone knowing what their roles and responsibilities are during the pandemic. So some general recommendations on how to behave or act during uncertain times, including the ongoing COVID-19 issue. So first of all, listen to and rely on credible sources of information only, such as the CDC, World Health Organization, and Health Canada. They update their guidance documents and their information almost daily. And those are the resources I rely on. Communicate accurately, honestly, and professionally, and do this as often as you can. Have a plan. Again, have a plan, just like we said throughout this presentation, and then follow through and be able to adjust as changes arise. Also, businesses should really think about and prepare for a potential second wave of COVID-19 in the fall now. I know we're all busy trying to react right now, but this may be with us for a while longer. Use what we have learned so far to be proactive and make your operations as resilient as possible. Be proactive and follow current guidelines, which, as we said, are changing. And, take a break and stop listening to the news. This is also good for your mental health. Have a virtual happy hour. I've done these already, and they're actually a lot of fun. And finally, accept the new normal. It is here to stay. All right, so at this point, Elaine, I will turn it over back to you. And I think we're gonna have some questions and answers maybe.
Yes, thanks, Andreas. Jason and Dave. Yeah, we do have a few minutes left. So there were a couple questions that were raised in the chat window. We don't have time to answer all of them, but I've summarized a few that were asked by more than one person. So if you're okay, we'll address these now. Does that work for?
Yes, I just tried to get off mute. Sorry.
Sorry. Okay.
I'm available. I can answer some questions.
Yeah,
excellent. Okay.
Yeah, likewise.
Okay, perfect. All right. So the first question we have: how can air sampling for COVID-19 be done?
Yeah. So maybe I'll take a stab at that. So everyone wants to know what's in the air, what's their exposure, is the building safe for occupancy, is the air that we're breathing acceptable, and that's very challenging for COVID. Well, it's very challenging for any microbiological contaminant, whether it's mold or bacteria or viruses. Right now for COVID-19, there is not a commercially available method available that we can use. I cannot go and take a sample similar to what I do for, let's say, mold assessments or industrial hygiene, and send it to a lab and have that lab analyze it and give me a number that I can then interpret in terms of what's good and what's bad, or if it's present or not. That whole science is evolving. It is happening. We have testing available now for surfaces. And that's a whole other discussion. But as far as air sampling is concerned, there is currently nothing that we can do right now. Is that changing? Will there be a test down the road? Maybe. Will it be useful? That's a whole other discussion. I think the air sampling that we're recommending right now, if someone wants to do air sampling, is more general. It's indoor air quality testing. It's testing for dust. It's testing for CO2, not to determine virus levels, but to assess the building performance. And with the intent that if the building is performing well, dust levels are low, CO2 levels are low, that we are providing the best possible environment possible, and exposure to the virus, if present, should be minimal and should not represent an exposure risk to the occupants. So I hope that makes sense. I don't know, Dave or Jason, if you want to add anything to it, but that's how I would answer that.
Yeah, I think that was a good summary, Andreas.
Okay, let's see if we can get to the next question then. If the virus can be airborne, why is duct cleaning not recommended?
Yeah, I can probably take a stab at that. It's a very good question, but according to ASHRAE and REVA, among others, duct cleaning is not effective against room-to-room infection because the ventilation system is not considered to be a contamination source. Viruses attached to small dust particles will not deposit easily in ventilation ducts and normally will be carried out by the airflow anyhow. Much more important is to increase outdoor air supply and avoid recirculation of air in the building than to really worry about duct cleaning at this time.
Yeah, I think that's great. I think the only thing I would add, Dave, is that there are exceptions. So healthcare facilities and maybe any building that housed or was used for patient treatment of COVID-19 patient, there might be additional precautions and additional recommendations as far as the duct systems are concerned. But I totally agree. I think with most buildings, duct cleaning is currently not recommended and is not necessary.
Right.
Okay, let's squeeze one last question in. Here's one more. You mentioned ATP testing a few times. What value does this have if it does not test for the virus?
I can handle that one, Elaine.
Okay.
So ATP and micrometer testing generally measure biological loading on a surface. So both are generally can be used as a surrogate test. Theory is that if the surface is sufficiently cleaned of the biological loads, then it would demonstrate that the sampled surface has been effectively cleaned. There are advantages of this particular form of testing. One of the greatest ones, it's much quicker. When using it as a means of cleanliness, in some cases you can have your results in less than an hour. You can collect many more samples. So in turn, it could be materially cheaper. Also, there's no shipping of samples, so you don't have to wait the 5 to 7 days for the turnaround. There are disadvantages, obviously. They do not determine viral loading in the airborne environment or even on surfaces. So if you do need to know specifics, in this type of test would not be applicable. False positives are an issue, and the ATP, and the micrometer itself do not have standardized methodology. So each tool is different, has different benchmark values. They're not always clearly defined. So the question is, what is the value as it pertains to the application of COVID-19? But because viruses are associated with living cells to replicate, ATP is a generic marker of biological contamination and does allow you to monitor potential viral contamination, but indirectly. If there's anything else to add there, guys, jump in.
No, it's good.
Okay, well, thanks for that, Jason. And unfortunately, we're running out of time now, so I want to thank you all. This brings us to the end of the webinar. So on behalf of Andreas Wagner, Jason McGonigal, and Dave Aris, we hope that you found the webinar useful and learned something new that is relevant to your business and operations for your buildings. Please take a moment to complete the survey that will follow. And if you have any questions about today's presentation or Golder's EHS and industrial hygiene services, please contact any of our speakers. So with that, be safe and enjoy the rest of your week. Thank you.
Thank you.
Yes, thank you.
Thanks.